This week we're going to go over the analysis of the sagittal and horizontal films. The key things you're going to want for this week are an OpalRad login. If you don't have a login, make sure you grab one from Dr. Khalsa or someone else who already has a login so that you can actually try and just get familiar with the actual program. Once you're somewhat familiar with the program, there is a video to kind of show you some essential basics of this already on the Moodle website. Once you have that done, that's a good time now, to go ahead and go through this just to kind of understand a little bit more of the basics of how to analyze these X-rays. By all means, this is not an all-inclusive everything you need to know. It is more of the basics of, where should the points be placed, what are the terms called, and kind of proceed from there. In order to get more information from this, you'd want to attend the Fundamentals 2 seminar series that Advanced Orthogonal does on a biannual basis, or go to the boot camp. Alright, so the first thing we want to cover, make sure again that you're looking at this X-ray right here, follow it up by this X-ray. Reason why that's done is you take this one first so that you can get your two lines that we'll go over. This guy is not reliant upon this X-ray, which means that you can take these two without ever having to place any lines down. So especially for those doctors who are doing plain film, this works out great. When you're doing digital, you can start with the horizontal or you can start with the sagittal. It really doesn't matter. But for teaching purposes, let's stick with doing the sagittal first, followed up by the horizontal. So let's focus on the sagittal. As you guys remember, we've already covered most of this. The atlas sagittal plane line is just, a sagittal line. We call it the S line sometimes. But really, in Advanced Orthogonal, we do call it the ASP. We do not take anything beyond an S2. If it's an S3, S4, or S5, we don't use it. We actually go to just an S2 at 10. We'll explain a little bit more about that later. But or even in the previous ones, we've already talked about that. So how to actually scribe this line, you want to use the horizontal angle. That's what it looks like. And obviously this angle that we're taking is for the actual frontal view. So the first dot that you do place is right here. Okay, this is at the corner of the posterior lateral mass and the inferior posterior arch of C1. Once you have that dot, you're going to go about 1/4 of an inch away along the inferior side of the posterior arch. Once you do that, this line will automatically scribe. It will give you a degree right here. It will not give you the S2 or S1 or S0 value. That's something that you as a doctor have to actually realize. And that's why we had that previous slide to explain what that is. Really, all it is just trying to say where should that person have their head in relationship to the central ray. Very, very simple. You would be setting the X-ray tube to the 18 degrees, for instance, with this person. Look on the external surface of that person to know exactly where that atlas is, and make sure that the head is positioned in the right fashion. So, are they supposed to tilt their head up or down a little bit to make sure that they're going through the right feature. This one obviously is going through the nose. Okay, very simple. There are some times where there are two arches that can appear. We won't go into why this would actually be. That would be more of an advanced thing. But just in case if there are two arches, just realize that you want to pick the top one. So if the angle is past 20 degrees or is an S3 or above, then you want to take the frontal view at an S2 at 10 degrees. Again, all of this is a review of last week. Alright, for the axial angle, this is used to actually take the axial view. use the horizontal orthogonal angle. It's a little bit different tool than the one we just previously used. This one is actually going to describe a perpendicular angle. So the first dot, posterior inferior portion of the dens. Okay, so you have the dens right there. We're basically describing George's lines, you guys. So there goes the first dot. Next dot after that, you're going to describe it down. Immediately when you do that, this line will form. As that line forms, it's going to give you a numerical value for the degree. However, there's three things that we want to actually take note with this value. One, is it cephalad or caudal? So is it a positive value or a negative value? That's going to help you when you're placing your central ray and your tube tilt. After that, obviously, the angle. So is it a 5 or a 4 or a 3? So you already have the positive or negative, and then the actual angle. And then what's the S line? Okay, is it an S arrow? Typically it is. It doesn't have to be. I've seen some really bizarre ones where it's coming out the chin, and I get really creative to try and figure out how to actually get that extra X-ray. But those are the three things you want to actually take note of. Now is actually a good time to draw the actual angle on your schematic if you do have that. This is the completed analysis. Obviously the two views that we do get from this are the frontal and axial views, and that makes sense because you have to describe these two lines to know exactly how to get those other two views. So just as a refresher, you set the X-ray tube right here on the ASP line. That X-ray goes through, and lo and behold, you get a frontal view. If you then change the tube position to the axial angle, and you take the X-ray goes through, and lo and behold, you get the axial. Alright, again, another time that you'd want to draw the ASP line and the axial angle in your note packet. Perfect time to do that. Highly suggest that however you guys want to draw it in with different colors, whatnot, go for it. But make sure that you're placing these dots in the correct position. Okay. And again, this one right here is the ASP line. This one right here is the axial angle. Alright, going back to our 4 shots, we've just covered the sagittal view. Now we're going to go to the horizontal view. Now, this guy can be a little bit complicated. We're going to try and keep it as simple as possible for the purpose of this class. First thing we need to understand is some of these concepts. So with this X-ray, there's a concept called zoning. Now, also in the frontal X-ray, you're going to learn a different way of zoning, but it's kind of the same principle. Alright, so this one, what's going to happen is that you're going to place this template over the X-ray. Now we'll show you in the next couple slides how that actually looks. But you're trying to find the skull's symmetry. Okay, the nasal cavity line right here, this is more to be used as a starting point, not necessarily does it have to be always on that nasal cavity. Okay, down here, this is actually used back in Grostic days. It is not used for the advanced orthogonal technique. So these areas right here are where you're going to be placing the template on the X-ray. So that top portion is where the frontal bone is going to be, and the back portion is going to be behind the mastoid. So the mastoids would sit right here and right here. So to show you how this would look, first of all, you place the AO vertex calculations, and note that the AHRY is called pre-Y. Okay, you'll be seeing this over and over again. The AHRY just means the atlas horizontal rotation along the y-axis. Okay, once again, the atlas horizontal rotation along the y-axis. So the first thing you're going to do is the horizontal cephalic line, the HCL. This is where you're using that template. So notice, when you just place it down, we're looking at this point right there, this point right there. It just so happened that it was placed perfectly. Down here though, we're looking to see what's the distance between those two areas right there and these two areas right there. Where are the mastoids? They're up here. So we're totally clear from them, no big deal. We're totally fine. This is where we're zoning. Okay, again, here are our dots that we're looking at. We're trying to make sure that everything is symmetrical. Once you do have that in a symmetry, pressing your greater than or less than sign, or your plus or negative sign, your up, down, right, left arrows. Once you have everything in that symmetrical line, that's when you press that question mark, and that will set that HCL. If you want to have a little more of a clue of how to do that, there's another video showing me actually analyzing an X-ray to give you a little bit more of a detailed view. This is to let you know the actual placement of how things are to be used. The atlas horizontal plane, the AHP, typically don't actually say that, but for reference, that's what it is, the AHP. We want to use the AO vertex atlas line. Okay, find the best fit and looking at the 4 possible sites. Well, what are those sites? The first one is your anterior superior lateral mass. These can be a little bit hard to see sometimes, but they're there, I promise you. Transverse foramen. These guys almost always are the easiest things to see. Okay, but again, they're not always correct. That's why we're using 4 different sites to make sure that we know what's their genetic norm. The posterior superior lateral mass sometimes can get confused with the inferior, right here, this is the inferior lateral mass. These guys are the superior lateral mass. Try really hard to make sure that you're not just choosing the oval. You want the kidney bean. Okay. The fourth one that we're going to be looking for is actually the neural canal. And this is a perpendicular line scribed from the anterior to posterior tubercles. Sometimes this is also a little bit difficult to see, but it's there. So again, this view is very difficult, but with lots of practice, you'll get it just fine. It will become second nature. Once you have these 4 lines, you're going to superimpose them to try and figure out which one's the best fit. So, scribing all the lines together, you pick the one that you want, and then erase the other ones, and you're going to place it back down to where it's supposed to be. This is important to note so that when you do the post x-rays, you know which one you're actually going to use. Once you have those 2 lines completed, that is it for the actual analysis. So you can notice here on this top right hand corner, it automatically scribed what's called the pre-Y. Well, the pre-Y is just the AHRY right here, the atlas horizontal rotation within the y-axis. So those 2 lines create that acute angle, and for this one you can note that the acute angle is on this right side. Okay, we want to see a perfect cross. Normally what we want to see is between a 0 to 0.25 degree of rotation. That's within a normal range. So with this person right here, it's at a 1.52. So that's actually roughly 6 times out of the range it's supposed to be. This value, once you do have this down, it needs to be transferred over to the horizontal view. We'll go over that at a later time, but just recognize that this value that you get, the pre-Y or the AHRY, is not automatically transferred over to all of your other calculations that are done on the frontal view. With that being said, go ahead and draw on the following lines. You want the HCL, the AHP, and this creates the AHRY, or pre-Y if you're looking at the digital x-ray. This concludes the PowerPoint for this week. By all means, definitely look at the form, do the quiz, and do the practice that we have on Moodle. Also, start preparing yourselves for actually doing the assignment of analyzing an x-ray series and taking a screenshot to submit to Dr. Stan for him to check your work, make sure you actually put the dots in the right place. And good luck!